Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Kerunne and I'm here today with Dr. Kerunne Ketlogetswe, cardiologist at MedStar Heart and Vascular Institute. I'm really excited about today's topic because we're going to be discussing something very, very important, high cholesterol. So if you've been wondering what those numbers mean or what is good versus bad cholesterol, stick around, share this with your friends, and please ask your questions in the comments below. Thank you so much for joining us today. I really appreciate it.
Thanks for asking me to speak today, Karen. I'm really glad to be here. It's Heart Month, and there's no better time to raise awareness about heart disease amongst our patients and let people know about their risk factors for heart disease and what they can do to lower their risk factors for heart disease. And cholesterol is one of the leading risk factors for heart disease, and so I'd love to help talk to our people about what we can do to lower our cholesterol. I'm a non-invasive cardiologist, so I practice out of MedStar Harbor Hospital. But beyond that, I call myself a preventive cardiologist. My work and my mission is to help people lower their risk for heart disease and educate them about the things they can do to make their hearts and themselves healthier.
Great, thank you. So we do have a few questions for you, so we'll get into it. Let's just get into those numbers that I mentioned. What do they mean?
Great. So when people get their cholesterol checked, they get what we call a lipid profile. And there are four main numbers that come out from your lipid profile. The main number is the total cholesterol. That measures all the cholesterol in your blood. The next number is the LDL, or the bad cholesterol number. LDL is a type of cholesterol that forms plaque or clot within the artery wall, and that's why we call it the bad cholesterol. Another number that comes up in your lipid profile is your HDL, or high-density lipoprotein. That's the good cholesterol. This you can think of as your helper cholesterol that scavenges the bad cholesterol from your blood, and so it reduces the amounts of bad cholesterol in your blood. Another measure is something called your triglycerides. Triglycerides are kind of fat that is found in the body. Triglycerides, when you eat food and your excess calories that aren't used get changed into triglycerides that can be then stored as fat in your body. And so it's another type. So your lipid profile will come up with four numbers, and each one has different significance.
Okay, great. So when is it considered to be high cholesterol?
It's a great question. Depending on your age and your risk factors, we'll sort of stratify what numbers we look at. So a total cholesterol, we want that number to be less than 200. If it's above 200, it can be borderline high. If it's above 240, that is considered exceedingly high. Your LDL, or that bad cholesterol, we really want that number to be as low as possible, especially in people who have established heart disease. So we want that number to be as low as possible. In most people, numbers between 100 and 130 are considered acceptable, although there's a lot of debate in terms of what we accept as acceptable, because if you look at comparisons with primates or in rural populations or populations that don't consume the typical American diet, their natural cholesterol levels are living more in the 40s to 50s, and that's probably where we should be living naturally, and it's just that our lifestyle drives it higher. The HDL cholesterol, or the good cholesterol, that's the number that you want to be elevated. So if it's less than 40 in men or less than 50 in women, that's considered low. If it's above 50, that's considered better. And if it's above 60, that is actually the best. And it can actually be considered protective because now you have higher levels of this good cholesterol around. For your triglycerides, we want that number to be less than 150.
Okay, great, thank you. So what causes high cholesterol?
A lot of factors play into causing you to have high cholesterol. There are some factors that you can't control. For example, you may have a genetic predisposition that affects the way that your body makes LDL or clears LDL from the body, and that can raise those bad cholesterol levels. Or you may have genetic factors that decrease the amounts of good cholesterol that you have in your body. But there are a lot of other factors that can cause people to have high cholesterol that you can impact, okay? So one of the main ways that you can have high cholesterol is if you consume a diet that's high in saturated fat. Where does saturated fat come from? So saturated fat is found in animal products. So if you eat meat, in butter, in full-fat dairy products, and cheese, those are high in cholesterol and fats. The ones you really want to avoid are the trans fats. Those are the fats that have been modified and are really implicated in raising LDL levels. So that you will find in processed foods and packaged foods. In fact, the FDA is going to ban the incorporation of these trans fats by 2021.
Oh,
you will
wow.
no longer be allowed to manufacture trans fats or to be sold in the foods that we buy.
That's great. So what are some ways that people can manage high cholesterol?
Fabulous question. When people think about managing cholesterol, they often jump to thinking that we have to use medications. But the cornerstone of any lipid management strategy is through lifestyle. I like to really push that point, that lifestyle. And by that, we mean things that you can do in the way you operate on a day-to-day basis to lower your cholesterol levels. So, for example, we tell people to reduce the amounts of saturated fats we eat, right? So remember what I said, the animal products, we said about full-fat dairy, butter. So if you can reduce your intake of saturated fats to less than 7% of your total caloric intake, you can actually reduce your LDL or bad cholesterol levels by up to 8 to 10%, right? Mm-hmm. Really avoid and don't eat trans fat. We tell people to exercise, right? So aiming to achieve 30 minutes of brisk exercise most days of the week can lower your LDL levels and actually boosts your HDL levels. We tell people if you smoke, quit, right? What smoking does is smoking affects your vessel walls and makes it easier for that LDL or bad, lousy cholesterol to make those plaques in your arteries, which lead to narrowings in the blood vessels. Worse yet, the plaques can then rupture or burst open and cause the acute heart attacks. And if you quit smoking, within a year, you've reduced your risk to half of that of a current smoker. We also tell people that to lower their LDL cholesterol, in addition to diet, exercise, and not smoking, is to maintain a healthy weight. So if your BMI or your body mass index is above 30, it increases your risk of having high LDL, which in turn increases your risk for having heart disease.
Great, thank you. Those are great tips. Let's talk a little bit more about medication. Can you highlight a few medications that are available and how do they work?
Yeah. So again, the cornerstone of any lipid management strategy is diet and exercise, but sometimes those aren't enough and we have to use medications to bring people's cholesterol levels down. There are different ways some of the medications act. So some medications work by inhibiting certain enzymes or key steps in the way that cholesterol is produced in the body. A key example of that would be statin medications. So people have probably heard of those medications the most. Statins are a potent way to lower your LDL levels. Our strongest or our most potent statins can lower your LDL levels by up to 50%. And that reduction in LDL is then associated with a lower risk of having heart disease. In addition to blocking the way that LDL is produced in the body, you can affect the way that LDL is recycled within the body. So if you increase receptors for LDL in the cells that can sponge up more of those circulating LDL levels and lower your LDL, then that's a really effective way. And so some of our newer blockbuster drugs, drugs like Repatha, some people may have heard of, an injectable medication which we really reserve for our highest risk patients or patients who can't take statins. Those medications really lower LDL levels to levels that we haven't seen before, unprecedentedly low levels, and really lower the risk of heart disease. There are some medications that block the way that your body absorbs cholesterol. So when you eat the food, it can block cholesterol absorption. So there are medications like bile acid resins and fibrates which can block the way we absorb. Medications can decrease triglyceride levels. So there's a whole host of medications that we can use, and your doctor can really advise you as to which medications are best for you and the kind of lipid abnormality or cholesterol problem that you may have.
Thank you. So we have some questions from our audience. So let's talk a little bit more about triglycerides. So Will asked, thank you, Will, how do triglycerides factor into the mix of different types of cholesterol? And what are some good tips to lower your triglycerides?
That's a great question, Will. So like I said, triglycerides are your body's way of storing excess calories as fat in the body. Some people may have conditions such as diabetes or thyroid conditions that can raise their triglyceride levels. So whenever we see people who have elevated triglyceride levels, we want to make sure that one of them isn't a secondary cause or that hasn't been caused by that problem. Diabetics can also have higher levels of triglycerides. Ways that you can lower your triglycerides other than medications are the same for everything: diet and exercise. So again, reducing your amount of saturated fat intake and your intake of trans fats can really lower your triglyceride levels. When we treat cholesterol, assuming that your cholesterol problem is not just primarily your triglycerides, our focus always, number one, first and foremost, is to bring your LDL level first down. That's the first priority because we know of the causal link, meaning we know that high LDL leads to cholesterol deposits and leads to heart disease. So we always focus on that as a primary strategy. Often, the medications that we use to treat that will also lower the triglycerides. But if they still remain elevated, then there are other medications we can add on top to lower the triglycerides. There are some foods that you can eat which can help bring down your triglyceride levels. So consuming foods that are high in omega-3 fatty acids can lower your triglyceride levels. Omega-3s are found in things like fatty fishes, like salmon, mackerel, tuna, are places where you can find omega fatty acids. If you eat foods that sort of have high insoluble fiber, it can block absorption of triglycerides. So things like oat bran, barley also help to lower triglyceride levels.
Thank you. Roseanne is asking, let's get back to numbers a little bit. Roseanne is asking, would you consider 210 to be high?
Yes. With a caveat, it all depends. But I consider any cholesterol above 200 to be elevated, and I work to bring that number down. Even if your number is 210, there are still things that you can do through lifestyle alone that can bring your cholesterol numbers into a more normal or a better range. But above 200 is considered abnormal.
Okay. Barbara's asking, how much does sugar play a role in heart disease?
Sugar plays a role because it increases your risk for obesity, right? And sugar often leads to people to have excess weight. With excess weight often comes an increased waist circumference, so that's central obesity that we talk about. Higher sugars also affect the way that those LDL plaques are deposited within the artery wall, so that's how sugar can play an effect. And of course, diabetes in and of itself, if you're considered diabetic, is a potent risk factor or one of the major risk factors for heart disease. So that's how sugar can play a role.
Thank you. We have another question from Marion. I have high cholesterol, but I'm allergic to statins. Every statin used has caused liver enzymes. Recently, a cardiologist suggested Welchol, but had to be taken off due to negative impact. Do you have any suggestions for her?
Yeah, so as someone who does a lot of work with high cholesterol and people who are intolerant or cannot take statins, it's a long approach. So it depends on what you've been tried on before. One of the side effects for this cholesterol medicine is people often develop muscle symptoms. And another side effect that people can have is that it can raise some of your liver function tests or cause them to be mildly abnormal. So that may have been the problem that you were experiencing. I often find that even people who come to me and are labeled as statin intolerant, I can usually get them on some kind of a cholesterol medication. And it's often a trial and error, right? So I often start people on a very low dose. I start once or twice a week and see if people can tolerate it. And then I gradually and very, very slowly up-titrate. And I often find that I can lower people's cholesterol. Even taking a cholesterol medication 3 times a week, for example, at a very low dose can get people to target. Some people that still doesn't work, and there are other medications that your provider can look at. For example, Zetia, you may have heard of, is a medication that can help lower LDL cholesterol. Welchol, like you mentioned, can also help lower it. There are, like we said, medications that can help bind cholesterol from the food that you eat within the intestine that can be tried. And like we said, these newer medications, especially if you're somebody who we are trying to aggressively lower your cholesterol levels because you have heart disease or cardiovascular disease, you may have an indication or meet criteria for one of these newer injectable medications as well.
Thank you. Hope that helped, Marion. Thank you very much. Keep your questions coming, everyone. We have another one from Melissa. This is going back to medicines. So can you explain some options that are out there that don't have any major side effects?
I wish I could say that there are medications that don't have side effects, right? But everything is a risk and benefit balance, right? And this is why managing cholesterol is really a conversation about assessing what your risks are, right? Looking at your cholesterol levels, how they fit into your profile, and what we can do to lower it. Cornerstone always being diet and exercise, and everyone always benefits by working on those things first and foremost and at all times, despite if we use medications. A lot of the medicines that we use have been studied extensively in a lot of trials, and every medication is going to have a side effect. Most of them affect a minority of patients, and assuming that you're closely monitored, most people can tolerate medications fairly well without side effects.
Okay, thank you. How often should you have your cholesterol checked?
Great question. So recommendations are that adults should begin having their cholesterol checked at age 18 and have it checked every 5 years. Some people, the recommendations will be to check it more frequently. Once we've discovered an abnormal cholesterol panel, once we start lifestyle modification or medications, then we check the levels periodically to make sure that the medications are working as we expect and having the effect that we want them to have. But every 5 years is the general guideline.
Okay, thank you. If any of our viewers do experience high cholesterol, should they be worried? What should they do?
Knowing your numbers is one of the big pushes about how you prevent heart disease. So if you were found to have high cholesterol, it is a marker or something that tells us that you're at increased risk for having heart disease. So if you know that you have high cholesterol, you need to know that it can be managed and it can be treated. Be concerned because of the risk, and then become proactive about the things that you can do to help try and bring that cholesterol number down.
Thank you. Let's talk a little bit more about risk and risk factors. What are the risk factors for high cholesterol?
Yeah. So the risk factors for having high cholesterol are a sedentary lifestyle. So if you don't exercise, it increases your risk for having high cholesterol. Eating an unhealthy diet, so eating foods that are high in those cholesterol that we talked about, animal fats, saturated fats, right? Smoking is a risk factor for having high cholesterol. Obesity or adiposity, so carrying more weight or more fat than your frame was ever intended to do, increases your risk for having high cholesterol. And then there's certain genetic predispositions or risk factors that we can't see but come from having a family history of other people in your family who have high cholesterol levels and may be passed down onto you.
Thank you. So I'm a mom. There could be some other moms watching right now. What about children? Can they have high cholesterol?
Absolutely. Children can have high cholesterol levels, and as we see more and more children becoming obese, and as we start detecting more and more diabetes in younger aged individuals, we're seeing more and more elevated cholesterol. The recommendation is that most children should have a screening cholesterol done somewhere between the ages of 9 and 11, and then again in later adolescence, just to rule out some of those causes. But the most often the common cause is genetic problems that cause people to abnormally produce or process or get rid of cholesterol.
Thank you. That appears to be all the questions that we have for now. Is there anything else you'd like to share with our viewers that we haven't covered?
I hope everyone can see that cholesterol management is about changing your lifestyle, and that there are things that you can do proactively to help lower your cholesterol. It's Heart Month. Use this opportunity to get to know your numbers. If you don't know them, have them checked. Remember, having high cholesterol is asymptomatic. You can't tell when you have high cholesterol unless it's checked. So if it's been a while since you've had your cholesterol levels checked, make sure to check in with your doctor and have your levels checked.
Thank you. We hope you learned something today about high cholesterol. If you would like some more information or would like to schedule an appointment, please call 410-350-2106. Thanks again for joining us, and thank you for being here today.
My pleasure. Thanks.